Now, the situation could be turning for the better in the United States. University of Texas study shows that COVID-19 death toll is likely to peak in 9 states by the end of April. Needless to say, the U.S. is facing the worst of the pandemic. Over 1,800 deaths have been reported in the last 24 hours alone. So far, the U.S. has recorded more than 7 lakh confirmed cases and over 39,000 deaths. The researchers at the University of Texas have identified 9 states where the death toll is peaking. The model predicts that New York and Louisiana will be past their peak by April 19th. That is by almost the end of April. New Jersey, Michigan, Colorado, Connecticut, Florida, Nevada, Massachusetts will also have already seen the worst of COVID-19. Researchers believe the situation in Washington, D.C. is also easing. There is already a widely used model developed by the University of Washington. The White House has also used forecasts made by this model during the daily press briefings. And according to the model, the U.S. death toll should have peaked by April 13th, but the U.S. has not peaked yet. The University of Texas researchers have tried to rectify one flaw in the model, the impact of social distancing. The University of Washington model relies heavily on patterns of reported deaths in other parts of the world, including Wuhan in China. The University of Washington model also assumed that with the introduction of the lockdown, the number of cases and deaths would begin to fall almost immediately. But social distancing norms are followed differently across the world. Social distancing norms are followed differently even within the United States. As we know, the intensity of which social distancing is practiced determines the overall number of cases and deaths. So the University of Texas study traced or tracked the local impact of social distancing through GPS traces from millions of mobile phones. The cell phone data showed how often people congregated in public places such as restaurants, bars, schools, parks, pharmacies and grocery stores. Keeping these factors in mind, the University of Texas study accounts for a greater uncertainty. It also shows that the states may peak individually at different points in time depending on the level of social distancing. The University of Texas study says that several states may not peak until May 7th. The researchers have shared the new projections with the U.S. Center for Disease Control and